Hello guys, welcome and welcome to Metier Academy, one of leading academy in training nurses in the nursing competitive exam as well as IELTS, NCLEX and OET training. Welcome back to Magic Pill session. As you all know that in Magic Pill session, we are discussing very important topic which is previously asked in the exams and also the additional points and MCQs which is very important for your upcoming examination. In that series, today we are going to start with a new system, that is endocrine system. Simple and very important question so far asked in the exam, repeatedly asked in the exam, that what we are going to discuss with the rationale. Okay, see, it is going to be like a discussion session. So watch the video till the end. Definitely it is going to be so much useful for you for your upcoming examination. Okay, so let's start the session. So scenario based questions are there. All the questions which I have taken here, which is from the NORCET examinations. Okay, so let's begin the session with the first question. A 52-year-old male present to the emergency department with a complaint of polyuria polydipsia. As you all know that polyuria polydipsia, you can see in two disease conditions, that is diabetes insipidus as well as in the diabetes mellitus, right? And unexplained weight loss for the past 2 weeks. Okay, his random blood glucose level is 360, shooted up. Okay, it is 360. And urine analysis, ketones are positive. So which clinical feature is commonly associated with hyperglycemia in such patient? Okay, so clearly these signs and symptoms make us to understand the patient is suffering from diabetes mellitus. Okay, and here they have mentioned very clearly the key point is ketones are positive. Whenever the ketones are positive, the ketones positive is commonly seen in the type 1 diabetes mellitus. Okay, so on urine analysis, ketones are positive. Which clinical feature is commonly associated with hyperglycemia in such patient? So all these manifestations is related to which options, which 4 options are given here. Among these 4 options, which is going to be the correct one? Bradycardia. Whether the bradycardia will be related to diabetes? No. Option B we can keep side because that is the right answer. Hypotension, it is not going to connect with ketones or adaptive mellitus. Meiosis is also not at all related. So which one is left? That is ketonuria. Ketonuria means nothing but the ketones, it is present in the urine. See guys, mostly in 2 conditions the ketones will be present in the urine. The first one is, it is a complication of type 1 diabetes mellitus. Type 1 diabetes mellitus patient, mostly they will be having the ketones, that is the broken particles, the end particles of protein in the urine. That is called as what? Ketone. And the second thing, even though the patient is not type 1 diabetes mellitus positive, still they will be having what? Ketones in the urine. How it is possible? If the patient is starving, not taking any food continuously from morning to evening or overnight, total fasting is there. So that time, sometimes even the non-diabetes patient, they will be having what? Ketone positive. In that situation, you have to check for the glucose. If the glucose is normal but the ketones are positive, you should ask to the patient whether they had any food for the past 12 hours or 14 hours. If they doesn't ate any food, it shows that because of starving, the ketones are positive. Okay, so this is all about the first question. So here the right answer is going to be option B, that is ketonuria. And the next question is, a 45-year-old woman with a history of thyroid surgery complained of tingling sensation around her mouth and fingers. Tingling sensation around the mouth and fingers along with the muscle cramp. The patient underwent thyroid surgery. That is the key point. On examination, Chowstic sign is positive. Usually Chowstic sign, when it will become positive? During hypocalcemia. Okay, so the history is the patient underwent thyroid surgery. Now the Chowstic sign is positive. So here what they are asking is, which electrolyte abnormality should the nurse anticipate? Which electrolyte abnormality the nurse should expect from this patient? Usually, what is the complication of thyroid surgery? See, parathyroid glands are situated within the thyroid gland. So, if the thyroid gland is removed, automatically parathyroid gland will be unfortunately removed. If the parathyroid gland is removed, means automatically parathormone secretion is also going to be decreased or stopped. So, parathormone function, as you all know, that it maintains the calcium level in the blood. So parathyroid gland is removed means parathormone will not be there. So calcium level will not be maintained in the blood. So it leads to hypocalcemia. So here the right answer is going to be what? Option B, that is hypocalcemia. It is a direct question because they have clearly mentioned Chaustick sign. Chaustick sign is positive only in the hypocalcemia. Two signs are positive in the hypocalcemia. One is Chaustick sign. Another one is Trousis sign. That is carpal pedal spasm. Okay, two signs will be positive in the hypocalcemia. And in hypercalcemia, the patient will go for what? Genu valgum, genu varum. Okay, that is another concept. Okay, if the parathyroid secretion is more, that time genu valgum, genu varum, that kind of abnormalities will be there. Okay, guys, fine. So the next question is, see, the rationale is there along with the question and answer. The rationale also I have mentioned. Just pause the video and just check it out. Okay. The next question is, a 60-year-old man with a long-standing hypertension, episode of severe headache, sweating, palpitation. Long-standing hypertension is the key point. So this patient is admitted for evaluation. His blood pressure during an episode is 220 by 120. Means the person is having severe blood pressure. Okay, that 220 by 120 is very high. Okay, so which diagnostic test is most useful to confirm the suspected diagnosis of pheochromocytoma? They have given the key point, that is pheochromocytoma. What is pheochromocytoma? Tumor in the adrenal gland. Whenever there is a tumor in the adrenal gland, it has two layers. Outermost layer, innermost layer. So in the innermost layer, there is a cell called as chromaffin cells. So that chromaffin cell used to secrete the catecholamines. What are catecholamines? Epinephrine, norepinephrine. What is the function of epinephrine and norepinephrine? It increase the blood pressure. Epinephrine is the central vasoconstrictor and norepinephrine is the peripheral vasoconstrictor. So if these two catecholamines are released means blood vessels are going to get contract. It leads to increase in the blood pressure. Understand the concept? So in pheochromocytoma, if the tumor is present in the adrenal medulla, excessive secretion of catecholamines will be there, excessive blood vessel contractions will be there. It leads to severe hypertension. Okay, fine. So here what they're asking, which diagnostic test is most useful to confirm the suspected diagnosis of pheochromocytoma? So this is the question. Okay, so what are the options here? Fasting blood glucose, serum cortisol, urinary catecholamines, and serum electrolytes. So here you can see urinary catecholamines is the correct answer. As I mentioned already, pheochromocytoma is there in the adrenal medulla, means more amount of secretion of catecholamines will be there, and the same catecholamines it is going to excrete in the urine. The catecholamine which is going to excrete in the urine, that is called as metanephrine and normetanephrine. Please make a note of this also. Okay, metanephrine and normetanephrine are the end metabolic product of the catecholamines. What are catecholamines? Epinephrine and norepinephrine. Understand, guys? Yes. So these are all the concepts you're supposed to remember. Okay. So this question, the right answer is going to be option C, that is urinary catecholamines. The next question is, a patient admitted with Addisonian crisis and is found to have severe hypotension. First, you should understand what is Addisonian crisis. See, Cushing disease and Addison disease both are opposite. Okay. In Cushing disease, glucocorticoid, mineralocorticoid, androgen level is going to be in the higher level. Matlab, cortisol, aldosterone, androgen level is going to be in the higher level. That is Cushing's. On the other hand, Addison's cortisol, aldosterone, androgen level is going to be very much less. As you all know that cortisol, it is a stress hormone, and aldosterone, it is used for reabsorption of sodium in water in order to maintain the blood pressure. And androgen is very, very important for developing the secondary sexual characteristics, right? Fine. So in Addisonian crisis, very, very less amount of cortisol, aldosterone, androgen will be there. Okay, fine. So here what they're asking, the patient is having severe hypotension. Definitely severe hypotension will be there. Why? Aldosterone is less, sodium and water reabsorption is less. So definitely severe hypotension, weakness and confusion. Okay. So the nurse anticipate administration of which immediate treatment? So what the nurse has to be administered immediately in order to overcome the Addisonian crisis. And here 4 options they have given here. Insulin infusion. Anywhere insulin is related to this Addison's disease or Addisonian crisis? No, absolutely not. IV hydrocortisone. Yes, it is a steroid. Steroid means it is a form of cortisol. Okay, so we have to consider about administering IV hydrocortisone in order to overcome this disease, right? Or overcome these symptoms. Oral glucose, no, it's not going to help. And calcium gluconate, absolutely, it is also not going to help. So the leftover option is IV hydrocortisone. See, IV hydrocortisone is the drug of choice if the patient is suffering from Addisonian crisis. Okay, and also fluid replacement. Okay, fine. See, once again, I'm repeating, Addison's disease or Addisonian crisis, severe depletion of cortisol will be there. So we are going to replace the cortisol in the form of IV hydrocortisone. That's why we are selecting option B as a correct one. Okay, so the next question is, a 28-year-old woman present with irritability, palpitation, weight loss, despite of good appetite. Heat intolerance is the key point. In which disease condition heat intolerance will be there? Hyperthyroidism or hypothyroidism? Hyperthyroidism. In hyperthyroidism, heat intolerance will be there. Hypothyroidism, cold intolerance will be there. These are all the very simple basic things, right? So, this one will make us to think about what? Hyperthyroidism. Okay. On examination, she has tremors, tachycardia. Definitely in hyperthyroidism, tachycardia will be there. And which medication is commonly used for the first line to control symptom in hyperthyroidism? And finally, they have mentioned the word also, hyperthyroidism. So now we have to search only for the drug of choice for hyperthyroidism. 4 drugs they have given here. Levothyroxine, commonly it is used to prevent the, or it is a drug of choice for hypothyroidism. Levothyroxine is the drug of choice for hypothyroidism, right? And propranolol, it is a beta blockers. It is totally different. It is used to reduce the heart rate. Insulin, in hyperthyroidism patient, no need for administering the insulin. And the last one is prednisolone, right? Fine. So here the right answer is going to be, the patient is suffering from what? Hyperthyroidism. So we are going to administer propranolol. What about prednisolone? It is a short-acting steroid, intermediate-acting steroid, or long-acting steroid. It is a intermediate-acting steroid. Okay, fine. It is not a short-acting. It is not a long-acting. Short-acting steroid is hydrocortisone. Long-acting steroid is dexamethasone. Okay, so here the patient is having hyperthyroidism and tachycardia is present. So whenever the heart rate is more, we have to focus on what? Beta blockers. Whenever blood pressure is more, we have to focus on alpha blocks. Please remember this, guys. This is very, very important point. Blood pressure is high means always give alpha blockers, alpha receptors blockers. And whenever the heart rate is high, think about beta receptors blockers or beta blockers like propranolol. So here the patient is having tachycardia, so you have to think about what? Propranolol. The next one is a 34-year-old male present with excessive thirst, frequent urination, dilute urine despite normal blood glucose level. Blood glucose level is normal, so the patient is not suffering from diabetes mellitus, but excessive thirst is there, polydipsia, and also polyuria is there. Okay, other than diabetes mellitus, this polyuria, polydipsia is commonly seen in which disease condition? Think like that. Then it will take you to diabetes insipidus. Okay, so for this question, the right answer is going to be diabetes insipidus. Clear? Next one. A patient with Cushing syndrome present with central obesity. See, Cushing syndrome means the classical features are double chin, purplish striae, truncal obesity, buffalo hump, and thin extremities. Okay, so all these things are coming under what? Cushing syndrome. Okay, fine. So the patient with Cushing syndrome present with central obesity and obviously moon face, I forgot to say, thin extremities, purplish striae on abdomen. Which laboratory abnormality is commonly expected? Hypoglycemia, hyponatremia, hyperglycemia, and hypokalemia. Always remember this, guys. Cushing syndrome, whenever the cortisol level is increased, it will increase the metabolism of carbohydrate. So automatically the glucose level is going to be high. So Cushing syndrome patient always has hyperglycemia. Please remember this. The same way, patient who is suffering from gigantism and acromegaly, gigantism and acromegaly. For those patients also, we need to provide diabetic diet. Why we need to provide diabetic diet? Because growth hormone is also increasing the metabolism of the body like carbohydrate, fat. So it increases the blood glucose level. Okay, so Cushing syndrome, cortisol level is increased. It will lead to increase in the metabolism. At last, the glucose level is going to be increased. So that's why we selected option C, hyperglycemia. Okay, the next one is 48-year-old woman present with lethargy, lethargy, weight gain, constipation, intolerance to cold. Intolerance to cold will make you to think about what? Hypothyroidism. TSH level is elevated. So again, another clue. TSH level is elevated means T3, T4 level will be decreased. It shows again the patient is suffering from hypothyroidism. So for hypothyroidism, what is the drug of choice? L-troxin or levothyroxine or thyronome. So which drug is given here? Okay. Which drug therapy is expected? Levothyroxine. Option B, levothyroxine is there. Okay. What about other options? Propylthiouracil. It is the drug of choice for hyperthyroidism. Propylthiouracil, it is the drug of choice for which condition? Hyperthyroidism. And one more important point. During pregnancy, in the first trimester, we can give propylthiouracil for hyperthyroidism patient. But second trimester onwards, propylthiouracil is contraindicated for the pregnant mother. Okay, so then you can ask one question, sir. So what we can give from second trimester? We have to give methimazole. We have to give what? Methimazole from the second trimester. Okay, first trimester propylthiouracil, second trimester onwards methimazole we can give for the pregnant mother who is suffering from hyperthyroidism. And what else? For this question, the right answer is what? Option B, that is levothyroxine. Clear? The next one is the patient undergoing pituitary surgery for acromegaly. Acromegaly is there. So why acromegaly? Because of hyperpituitarism, excessive secretion of the pituitary gland, which is the most abundant hormone secreted in our body. That is growth hormone, right? And growth hormone is secreted by the pituitary gland, right? So a patient undergoing pituitary gland surgery for acromegaly develops excessive thirst, urination post-operatively. After the surgery, they are developing excessive thirst and urination. So urine is very dilute and sodium is elevated. Which complication does this suggest? Can anyone guess the answer? Excessive thirst, urination, polyuria, polydipsia. After the surgery in the pituitary gland. So whenever you are getting this kind of thing, you have to think about the symptoms. Polyuria, polydipsia, other than diabetes, in which disease condition commonly seen? Diabetes insipidus. So here obviously the diabetes insipidus is going to be the answer. Right? Fine. The next one, SIADH. See, diabetes insipidus and SIADH. One simple difference is there. Diabetes insipidus, lack of secretion of antidiuretic hormones. So, excessive urine voiding will be there. Excessive micturition will be there. Right? So, in order to balance the excessive urine excretion, the patient used to drink more and more water. Okay, right? So, polyuria, polydipsia, both will be there in a diabetes insipidus. Just opposite to diabetes insipidus is SIADH, syndrome of inappropriate antidiuretic hormone. Here, excessive production of ADH will be there. So all the water will be retained inside the body. So the classical sign here is dilutional hyponatremia. Dilutional hyponatremia. Okay, fine. So on the whole, for this question, the right answer is going to be diabetes insipidus. The next one is a 40-year-old female with hyperthyroidism is being prepared for thyroidectomy. Which preoperative medication is given to prevent thyroid storm? So hyperthyroidism patient preparing for a surgery, thyroidectomy. Which preoperative medication should be given to prevent the thyroid storm? Insulin we will give for thyroid storm patient? No. Steroids? No. Levothyroxine? Obviously not. This is for hypothyroidism. And the leftover option is propylthiouracil. Propylthiouracil is the drug of choice for hyperthyroidism. Okay. Next one. A 55-year-old patient with Pheochromocytoma is scheduled for surgery. Already Pheochromocytoma explained very clearly that is tumor in the adrenal gland. Which preoperative management is most important to stabilize the patient blood pressure? Preoperatively, what we supposed to give to maintain the blood pressure? Previously, I have mentioned two things, that is alpha receptors blockers and beta receptors blockers. Always keep in mind, alpha receptors blockers is used to reduce the blood pressure, whereas beta receptor blockers, it is used to maintain the heart rate. Okay, for example, propranolol, it is a beta receptor blocker. It is used to maintain the heart rate. If the patient is suffering from tachycardia, it will reduce the heart rate and maintain the heart rate. Whereas alpha receptor blockers, it dilate the blood vessels and maintain the blood pressure. So here, pheochromocytoma means, always remember, hypertensive crisis will be there. Severe hypertension will be there. That time you should not give beta blockers. You always has to give alpha blockers. Okay, so here the right answer is going to be what? Alpha blockers first. Okay, the next one, 30 years old male with SIADH, syndrome of inappropriate antidiuretic hormone, present with headache, nausea, confusion, seizure. Definitely SIADH will cause excessive ADH production, so retention of fluid within the body. It will cross the blood-brain barrier and it will go to the brain and it will cause what? Cerebral edema, all those problems will be there. So his sodium is 120 milliequals per liter. What is the normal sodium level? 135 to 145 milliequals per liter. But here it is absolutely less because of dilutional hyponatremia. So what we supposed to do? So obviously the first focus is reduce the edema in the body, reduce the fluid accumulation in the body. How we will reduce the fluid accumulation? We have to give hypertonic solution. So where is the hypertonic solution? Option B, administer hypertonic solution. When you are giving hypertonic solution, the excessive fluids which is present in the intracellular space and interstitial space will be absorbed and it will be excreted out in the blood vessel, through the blood vessel. Okay, you understand the concept, right? It will be absorbed inside the blood vessel and excreted through the kidney. Sorry, it will excrete through the kidney. So we always have to give the hypertonic solution. Example of hypertonic solution, 3% normal saline is the hypertonic solution. Whatever the solution more than 0.9% is coming under what? Hypertonic solution. Clear, guys? Next. A 45-year-old woman present with hyperpigmentation of the skin. Always remember, whenever you come across the word hyperpigmentation, bronze hyperpigmentation or hyperpigmentation, think about Addison's disease. Okay. Okay. So low blood pressure. Obviously, in Addison disease, low blood pressure will be there. Weight loss, fatigue. Which lab report suggests Addison disease? Okay. Which lab reports suggest Addison disease? That is the question. High cortisol, low cortisol, high TSH, low ACTH. So here in Addison disease, always keep in mind the cortisol level is going to be less. Whereas in Cushing's, the cortisol level is going to be high. Cushing's and Addison both are opposite, right? So in Addison disease, which lab report we are supposed to check? We have to check for what? Cortisol. Okay. Next, a 40-year-old patient with acromegaly present with a joint pain. Acromegaly, remember that excessive growth hormone secretion after attaining the puberty. That is called as acromegaly. Before attaining the puberty, excessive growth hormone secretion will lead to gigantism, and after attaining the puberty, if the excessive growth hormone secretion is there, it leads to acromegaly. Okay, fine. So for this patient, joint pain, enlarged hand, feet, frontal boozing, that is the frontal region, it will be more prominent. Okay, so which investigation confirmed the diagnosis? TSH, serum cortisol, IGF-1 level and ACTH level. 4 options they have given here, and for this question the right answer is going to be option C, that is IGF-1, insulin-like growth factor 1. It is secreted by the liver. Okay, so whenever the growth hormone secretion is increased, it will stimulate the liver to release the IGF-1. Understand, right? So the investigation what we supposed to check is IGF-1 level for acromegaly patient. Okay, next one, a 60-year-old woman is admitted with severe hypothyroidism and altered sensorium. Severe hypothyroidism, the complication of hypothyroidism is mixed edema coma. Please remember that. Okay, that is also very important. So severe hypothyroidism and altered sensorium is there. She is bradycardic and hypothermic. Definitely hypothyroidism will cause what? Hypothermia and bradycardia. Which emergency complication is suspected? So already I said that severe hypothyroidism will lead to the complication called as what? Mixed edema coma. So the right answer is going to be mixed edema coma. The next question, a patient with Addison's disease, first key point, develop vomiting, diarrhea, hypotension, shock. After surgery, okay, fine. Which immediate nursing intervention is needed? Okay, after surgery, they remove the adrenal gland or whatever it is. So, Addison disease patient, after undergoing the surgery, they develop vomiting, diarrhea, hypotension, shock. It means all these symptoms, it shows that the patient is suffering from what? Hypovolemic shock. Okay, so always we have to treat this with fluids. Okay, so here you can see where is the fluids. Whether we need to give antibiotic, no. Glucose, no role. Oxygen, absolutely no role. So fluids and steroids we need to give to overcome this disorder. Okay, so for this question, the right answer is going to be option A, that is IV hydrocortisone and fluid. Always in Addison disease, we will be giving what? Steroids like hydrocortisone. Hydrocortisone is the short-acting steroids, and according to the signs and symptoms, we're supposed to start with the fluid. So hydrocortisone and fluid is the right answer. A 55-year-old patient with hyperparathyroidism. Hyperparathyroidism. The parathyroid gland, where it is situated? It is situated in the thyroid gland. Okay. So a 55-year-old patient with hyperparathyroidism present with bone pain, muscle weakness and constipation. Definitely it will be there. In hyperparathyroidism, what will happen? Excessive secretion of the parathyroid hormone. Whenever there is an excessive secretion of the parathyroid hormone, more reabsorption of calcium from the bone. From the bone, more resorption of calcium will be there. From the bone, more resorption of calcium will be there. So all the calcium from the bone is taken into the blood. So in the blood, hypercalcemia will be there, but in the bone, it will become very weak. That's why hypercalcemia and hyperparathyroidism patient, they will be having genuvalgum genuvarum because of deformity in the bones. Okay, fine. So for this patient, which lab finding is expected? Definitely high calcium level will be there and low phosphate will be there. Calcium, phosphate, both are opposite. Whenever the calcium level is increased, phosphate level is going to get down, right? Fine. So option B and C both are correct for this question. Okay. Next, a patient with the newly diagnosed type 1 diabetes mellitus develops Kussmaul breathing. So type 1 diabetes mellitus, the complication is DKA, diabetic ketoacidosis. So for this patient, in order to compensate the acidic nature of our body, the respiratory rate and respiratory depth is going to increase. Always remember guys, Kussmaul respiration means two classical signs will be there. The respiratory rate and depth of the respiration, it is going to increase in the Kussmaul respiration in order to compensate the acidosis on the body. And also keep this in mind whenever you are getting any question related to DKA, diabetic ketoacidosis, the first and foremost management is treating the dehydration by administering the fluid, bolus of fluids. Okay, fine. And let's read the question once again. A patient with newly diagnosed type 1 diabetes mellitus develops Kussmaul breathing, fruity odor. Okay, the acetone breath will be there. Okay, confusion is there. Which treatment should be initiated first? Two things you have to keep in mind always whenever you come across the patient with DKA. Once the patient is confirmed with the diagnosis of DKA, start with 2 large bore IV cannula. That is a large bore IV cannula in right and left hand. In one hand, you have to start with the bolus of fluid in the first hour. And in another hand, you have to start with the insulin. But make sure that before starting the insulin, you have to check for the potassium level. Because whenever you are starting with the insulin will decrease the level of potassium in the blood. So always you have to think about that. Okay. So insulin you are starting means before starting the insulin, check the potassium level, and even after starting the insulin, you have to check for the potassium level. Depends upon the doctor's order, but potassium level monitoring before and after starting the insulin is very, very important. That too, after starting the insulin is very, very important. Suppose if the potassium level is decreased after starting the insulin, start potassium infusion also. Okay, fine. So for this question, which treatment we have to start for the patient with DKA? IV regular insulin plus fluids. Regular insulin. I'm not saying rapid acting insulin or intermediate acting insulin like NPH or long acting insulin like Basolog. I'm talking about short acting insulin, that is regular insulin. Okay, always we used to prefer regular insulin and fluids for DKA patients. The next one, a patient with a long-standing diabetes present with blurred vision, proteinuria, decreased sensation of both feet. These are all the complications of diabetes mellitus. These findings indicate which complication? Very simple. Blurred vision, retinopathy. Proteinuria, nephropathy. Decreased sensation of both feet, neuropathy. So the right answer is going to be option A. Simple, direct question. A 30-year-old woman with a Graves' disease, autoimmune hyperthyroidism is caused by the Graves' disease. Please make a note of it. Autoimmune hyperthyroidism is caused by the Graves' disease. Okay. So a 30-year-old woman with Graves' disease present to the emergency with high fever, tachycardia, agitation, sweating. Definitely these things will be there because these are all the symptoms of hyperthyroidism. This is an emergency of which type? Graves' disease, it will cause what? This is commonly seen. It is an autoimmune disorder of hyperthyroidism. So what is the complication of hyperthyroidism? Thyroid storm. So here right answer is going to be option A. You should know to correlate with the disease condition. For hyperthyroidism, if it is caused by an autoimmune disease, that is mostly Graves' disease. Hypothyroidism, if it is caused by the autoimmune disease, that is going to be Hashimoto disease. Graves' disease, hyperthyroidism. Hashimoto disease, hypothyroidism. Remember that. A patient with a diabetes insipidus which has a urine output of 6 liters per day. Normal urine output 1500 to 2000 ml, but here 6 liters per day is diabetes insipidus. Is having diabetes insipidus. Which drug is commonly used to reduce the urine output and control the symptoms? Say diabetes insipidus, what is happening? You should know the pathology. Lack of secretion of antidiuretic hormone, right? So that's why excessive urination is going on. So give the ADH, synthetic ADH from outside. Okay, the name of the synthetic ADH which is available in the market is desmopressin. 60 micrograms per 60 micrograms dosage is available. Okay, so the desmopressin we have to give from outside so that these problems will be reduced. Okay, so the drug of choice for diabetes insipidus is desmopressin. It is nothing but vasopressin. It is nothing but antidiuretic hormone. Okay. Next one, a patient with Cushing syndrome is scheduled for adrenalectomy. Cushing syndrome, so adrenalectomy is planned. Which post-operative complication should the nurse monitor closely for? Okay, in Cushing syndrome, what is happening? Hyperglycemia will be there, hypertension will be there, hypokalemia will be there, and hypernatremia will be there. Okay, but after removing the adrenal gland, all these symptoms is going to get upside down. Hypertension is going to become hypotension. Hypernatremia is going to become hyponatremia. Everything is going to become upside down. So if you are thinking like that, definitely the answer is going to be what? Option A. After removing adrenal gland, the answer is going to be hypotension. Before removing adrenal gland for Cushing syndrome, the answer is going to be hypertension. But after removing the adrenal gland, the answer is going to be hypotension. Okay. Next one, a 65-year-old man with SIADH develop worsening hyponatremia. So this is the classical sign of SIADH. SIADH patient, they will be having excessive secretion of antidiuretic hormone. So dilutional hyponatremia will be there. Always remember guys, whenever the patient is suffering from severe dilutional hyponatremia, the fluid will be shifting to the cerebrum. It will cause cerebral edema. So here also they said the same thing. SIADH patient develop hyponatremia even after the fluid restriction. Which medication may be prescribed to block the effect of ADH? Block the effect of ADH, and here the right answer is going to be option B, tolvaptan. This one is going to block the effect of ADH. It is a tolvaptan is a vasopressin antagonist. Vasopressin antagonist. It is given against the ADH. So the next one, 50-year-old woman with the Pheochromocytoma tumor in the adrenal gland develops severe hypertension during tumor manipulation surgery. They are trying to remove the tumor. Which drug is immediately administered? Pheochromocytoma, they develop severe hypertension. For severe hypertension, the first drug of choice is nitroprusside. Nitroprusside is a rapid-acting vasodilator used to control the intraoperative hypertensive crisis. Intraoperative hypertensive crisis, please remember that during the surgery, if the blood pressure is increased, the first drug of choice is going to be nitroprusside. The next one, a 38-year-old woman with hyperthyroidism develop fever, tachycardia, confusion. The nurse suspect thyroid storm. That is the complication of hyperthyroidism. Which is the priority nursing action? Administer antithyroid drugs, beta blockers, give insulin, give dopamine, give IV fluids only. So definitely hyperthyroidism, we already know. So definitely we need to administer antithyroid drugs, and tachycardia is present, so beta blockers. Okay guys, so what was the session? So fast we have completed 25 question revision. Right? So these are all the questions which is previously asked repeatedly in the competitive examination like NORCET. So mostly in the upcoming sessions are going to be like this. Okay, so you may get use of these questions, understand the concept, understand the rationale, try to correlate the question and answer as well as the rationale, and clear the exams in the first attempt by joining the Meteor Academy. Thank you very much for watching the video, guys, and all the best for your upcoming exam.